Working across the healthcare continuum across Africa, we have witnessed that there is a great polarity of beliefs between the different components of the ecosystem: public versus private, provincial versus national, specialization versus generalization, differentiation versus integration, and profit versus social good. With so many presumed beliefs and differences in terms of perceptions, views, and objectives, it's difficult to see that the outcomes of all our actions are related to the same entity, the patient. In a system with such a high degree of complexity, such divergent views, and such a high price to pay for our inability to compete and collaborate appropriately, we at KPMG would like to create a single vision which we can all unite behind. To do this, we are going to share with you the voices of the people who we work with, who live and breathe healthcare every day.
The greatest challenges are in human resources. We have a wonderful group of people, but we don't have enough of them to service the amount of patients that actually need care in South Africa.
Well, the South African private healthcare sector has a crisis of affordability. It simply uses far too many resources, but because of the price at which medical schemes are able to sell its services, it's really accessible to a relatively small number of South Africans. And so the question is, what drives that unaffordability? And I think the answer clearly is an enormous dependence on hospitalization. And so I guess the real problem is a lack of strong community level services.
Because the problems that communities have, for example, the cost of transport to our clinics. So I would like to see more outreach, more community-based drug distribution, health screening through mobile health services, through involving community-based organizations, and more household-based services.
The NDP has recognized the fact that we are actually having an ailing public health system which is unable actually to address the massive disease burden that we have. So we've had challenges, and I think most of the challenges almost like related towards issues like infant mortality, under 5 mortality, malnutrition, mothers in pregnancy not being able to have good outcomes, whereby the mother can die and the baby can die. And generally, I think there is a lot of poverty. And we know that cycle of poverty, it's gonna be poverty, disease, disease, poverty, and we are just caught up in that trap.
There is such a dichotomy between the private and the public sector. And they don't talk, they don't work together. The second dichotomy, which bothers me, is the divide between government and working with the private sector. I don't think government engages in the private sector enough. There's a whole rhetoric about it, but it just doesn't happen.
One of the key issues we deal with is harmonization of regulations, and it's having just the ability to move product between different geographies, and also addressing the issue of access to medicine.
The first one is around population medicine, which is understand that populations need health systems that are matched to their needs. So that's very important. But the patient in the population needs to be thought of as a person over time. So one needs proactive care particularly for complex patients, but one needs a care plan for every individual, and not just to react when they get into trouble.
Let us involve the people, but we need to collaborate together. And private and public sector cannot stand apart and point fingers. They have to come together and say, here's a problem, how do we actually solve it?
I have hope in Africa, and I have hope in the people of Africa, and I have hope in the wealth of Africa. I have hope in the resources and just who we are as Africans. And that hope is what keeps me in Africa.
There is no contradiction. Healthcare is, above all, a positive sum game. A game in which all sides stand to win. Governments, donor agencies, doctors, academics, activists, and private enterprise can lever each other's capabilities for the mutual benefit of all. and most especially for the benefit of the patient. A paradigm shift has begun towards healthcare systems that are actually suited to serving the billions still to be born across the developing regions of our planet. If you could join this conversation, would you be a voice or an echo?